actually not nervous when I get up to talk about sermon and most things. Like the mic. Anyway, but I was kind of twisted my arm to do this. So this is my own opinion. You can take it or leave it, and it's up to you. I've spent hundreds of hours reading about this, looking into it. I'm actually a germaphobe. As my wife is I'm a germophile. I eat more dirt. That's my mantra. But, Sigrid is the germaphobe. She's the one who sprays me down when I come home from work. So most of the time I'm not worried about germs. But this particular one, COVID-19, I've lost over a dozen family friends. And one of my workers, half my staff has gotten sick. One of my workers ended up in the MICU for a week, and with blood clots in her lungs and arms and legs, and an embolism. And she has permanent lung damage. She cannot return to work ever. This is permanent. She will never be able to work again. She's in her 40s. Right? This has consequences even if you don't die. So that's why I'm kind of passionate about this, and maybe I'm a bit overzealous. So just bear with me. I'm going to go through this fast, and you can look at it later on video if you want some of the references. I actually have a lot of references for each slide. All the facts have actual papers to back them up. So I'm not going to read through those for you today. If you want them, you can get them later. So hang on, we're going to go through this fast. So these are the topics I'm going to cover, the arguments that I usually hear that are most common. Just another flu season, 99% survival rate. It's a government bioweapon in order to control freedoms or remove freedoms. Masks and social distancing don't work. They're just another form of government control to remove freedoms. The mRNA vaccines are dangerous. They alter one's genetic makeup. They're poisonous. They're experimental and untested. They cause autoimmune disorders. They're unnatural and opposed to the Adventist health message. And natural remedies and my faith in God are enough. Okay, so here we go. Ready? So, just another flu season. It's not. There have already been 565,000 reported COVID-19 deaths, and that's a 30% underestimate. There's really been over 700,000 deaths actually related to COVID, and I'll show you why in a minute. So the argument that doctors are overcounting cases because they get paid more, that's just not true. They do get paid more for Medicare patients only, about 20% more, and there's severe penalties if they detect a pattern that you're overcounting, right? You get fined, and you can even lose your license. There's no pattern of overdiagnosis detected. COVID diagnostics actually are underdiagnosed as an all-cause death rate during this pandemic. So here's the all-cause death rate. It's dramatically higher. If you look at the bottom black line, since 2015 through 2019, that's the average death rate. Those are the lines for the death rate. All causes, everything you die of, that's the line. This is the line, the red line is for 2020, and then the purple line is for 2021. It's way higher. And you're like, what's killing so many people? 700, 800,000 people extra have died this year than in all previous years since 2015. What is it that's killing so many people if it's not COVID? The all-cause death rate cannot be explained except by COVID and things related to COVID. How many flu deaths are there each year? Well, they're between 20 and 40,000 each year on average. What's interesting about flu deaths, if you look at the bottom line, is that they're worse in the winter. Most people die of the flu and respiratory disorders in the wintertime. This is true around the world. This is another graph. It's almost identical to this graph. This is from Turkey. They had the same problem. Every country that you look at around the world has the same graph. So if you look at the seasonal rate for flu, this is what it looks like. It goes up in the winter, down in summer, up in the winter, down in summer. I'm telling you the reason for this, and I have papers for this, is because people are vitamin D deficient. If you just take your vitamin D, it will flatten out this line. And you won't get 20, 40,000 deaths every year. You maybe get less than 1,000. Vitamin D would have a dramatic effect if you just take your vitamin D on a regular basis. Adults, 4,000 units for most adults a day. We'll get more into that later. 99% survival rate. It's true for overall. 99% of people live after they get COVID-19. And so that's true, but it's misleading. After all, I mean, let's say you only have a 1% death rate overall. That's 3 million US deaths. How many people would be happy about that? Everybody exposed to COVID-19, 3 million people die eventually, right? Is that good? A good number? It's not a good number. So that's one of the things that's misleading. 1% is a lot, right? Also, 1% is only for young people. As you get older, your death rate goes up exponentially. You know, by the time you get to be over 85, your death rate is 30%. That's not a good number, right? It's like if it was reversed and the death rate for children was 30% and it was 1% for adults, you know, I think we'd take it a lot more seriously. Also, on the other side of the graph is the death rate from the flu per year. The COVID death rate is way higher than the flu. It's just not a flu season, guys. So here's another, and it's everywhere you look. This is from Ohio, same graph. As you get older, their death rate goes up exponentially. Survival rate, again, true but misleading. Let's say you survive. A third of those who survive end up with long-term illnesses, like one of my staff workers who will never work again. Some of them can be severe, some of them can be mild, but chronic. One of them, for example, this is in the news yesterday, this guy had such strong ringing in his ears months after having COVID that he killed himself. Their suicide rate is very high among COVID survivors because of the long-term consequences. The initial symptoms may be mild or no symptoms at all, like fatigue, smelling loss, loss of taste, strong ringing in the ears, brain fog, where people can't think properly for technical things. A third of people experience psychiatric or neurological illnesses that are chronic, mostly mood disorders, but occasionally strokes and dementia. All ages are affected similarly, including children. Of 34 children in one study, 11 were long haulers, had long-term symptoms that did not resolve months later. Here's a list of symptoms. You can look them up later. There are a bunch. Again, about a third of those infected with COVID end up with long-term illness called long haulers. Here's a quote. Many people who had asymptomatic COVID, which is most people, like 40% at least, also go on to develop post-acute COVID syndrome, said Dr. Petrino. It doesn't always match up with severity of acute symptoms. You can have no symptoms at all, but still have very aggressive immune response and long-term problems later on down the line. Many, ironically, start to feel better. If you have a long-term problem, long hauler syndrome, if you get the vaccine after that, you start to feel better. It tends to be a trend. I'm not sure what percentage it is, but quite a number have been discovered that after they get vaccinated, their long haulers goes away. Up to 40% of COVID-19 cases are asymptomatic. Across 4 different studies, people had asymptomatic infections. About half had grown glass opacities in the lungs on CT scans. Even if you had no symptoms, you still had lung damage that was detectable on CT scan. 2 studies have reported the same pattern in children with asymptomatic COVID-19 infections. The small blood vessels are reduced in the number, even in asymptomatic cases, so you have lung damage, but you don't notice it. You still can run around and play, and you don't notice it, except if you're like a high-level athlete or something like that. I think this is a quote, I think that if you're young and you have enough lung reserve, you're not going to miss it, because you're still able to function perfectly fine, says Dr. Marty, a professor of infectious disease in Florida International University. It's kind of like, say you have long hair and you cut 2 inches off. Most people won't notice that you had a haircut because you had such long hair. So we are built with reserves. Doesn't mean that you don't have some damage. You lose some reserves if you get COVID, even if you're young, even if you have no symptoms. Here's a picture of healthy lungs. In the middle is a long-term COVID lung with no symptoms, but you can tell a difference. The vessels are less. And acute COVID syndrome. 40% of cases are asymptomatic, again, across 4 different studies. I already told you that. All right, next slide. The study looked at 100 patients, median age of just 49, who recently recovered from COVID. Most had no symptoms or just had mild symptoms. The researchers who performed MRI scans of their hearts, an average of 2 months after they were first diagnosed with COVID-19, uncovered some concerning findings. 78% of patients had ongoing heart abnormalities. 60% had myocarditis, or inflammation of the heart muscle. Even more concerning was that the extent of the myocarditis was not related to the severity of the illness or the overall course of the illness. In fact, this happens in athletes as well. They get myocarditis, heart inflammation, months afterward. So what about the argument that it's a government bioweapon to control and eliminate freedoms? Well, is it a bioweapon? Yes, it is a bioweapon, but it's not a man-made one. I believe it's designed by the devil himself. But there's no evidence that it didn't come directly from an animal. Now, there's a lot of research on dangerous viruses around the world. This has got in America and China, and pretty much every government researches these things. I'm not really sure. I mean, they do research them to see if they can weaponize these things, but was it man-made? No, the evidence doesn't show that. And the reason why I think that this came from Satan is because everything evil comes from him. When Christ was asked, he told a parable. He said, "Sir, didn't you sow good things in this field? Where did the weeds come from?" And Jesus said, "An enemy did this." And so every evil thing comes from Satan. These are evilly bad things that are designed that way. And Ellen White, as far as accusing the government without really strong foundation, we shouldn't do that as Christians. We're supposed to support the government as far as we can. So our work is not to make a raid on the government, but to prepare the people to stand in the great day of the Lord. The fewer attacks we make on authorities and powers, the more work we will be able to do for God. This is not our calling, people. Our calling is to spread the gospel message, and this isn't it. Do all in your power to reflect the light, but not speak words that will irritate or provoke unnecessarily. Right? Teach the people to conform in all things to the laws of their state when they can do so without conflicting with the law of God. I was in the military, and this went a long way. I supported those guys as best as I could, except when it came to the Sabbath. And they respected me for that, and it went a long way afterward, even though I was brought up for court-martial twice. It's because they respected me in everything else that I got away with the Sabbath. Masks and social distancing don't work. Well, they're not 100%. In fact, they're not even very great, especially for those preventative measures as far as preventing you from getting illness by wearing a mask. Not very great. The best things masks do is prevent the spread of the virus because it stops big droplets. It doesn't stop aerosols so well, so if you're in the same room without ventilation for a long time with somebody who is sick, you will get sick even if you wear a mask, because masks like we wear here don't prevent these aerosols from being transmitted, but they do prevent big droplets from being transmitted, and so they reduce the dosage and also the severity of illness. So they do have a role to play. They're just not great. They're just one more layer to add on to protection. That's one more thing you can do that helps a bit, right? So I just want to point out, I would personally wear a mask in public places, even if I knew 100% that I could not catch or transmit the virus. Why? It's because it's a sign of respect to your neighbor, right? And I want to show my neighbor I care about them. And they don't know if I'm infected or not. So I wear a mask, even if I'm pretty confident. I'm vaccinated twice. I was one of the first ones vaccinated here in Reading. I highly doubt, and I'll get into that in a minute, that I can catch or transmit the disease. It's very rare, very unlikely. But I still wear a mask in public places because I want people to know I care about them. So again, here's just some illustrations on how masks work. They just prevent large droplets from being transmitted effectively. That's what they do. Coughing and sneezing, again, large droplets. If you have a mask on, they don't go very far. mRNA vaccines are dangerous. They alter one's genetic makeup. That's the claim you hear all the time. But the mRNA doesn't make it into the nucleus of the cell. You just don't understand basic biology if you think it can change your genetic makeup. The mRNA only makes it into the cytoplasm where it makes protein. Here's an illustration of it. It makes the protein, it stays there for a day or two or three, and then the proteins are exported, and then the immune system picks that up and it educates your immune system. The mRNA itself is like a sticky note where you read it a few times and then it goes away in a few days. It self-destructs. It doesn't stay there very long. It goes away rapidly. So the argument about poisons, the vaccines are poisonous. The mRNA vaccines contain mRNA, some sugars, some salts, and some lipids or some fat droplets. They do not contain any toxins. They do not contain adjuvants or preservatives like mercury, aluminum, or formaldehyde, and we can talk about that for other vaccines later. But these particular vaccines contain nothing like that. They do not contain cellular tissues or proteins of any kind. They do not require cellular cultures. They are synthetically produced. They are not derived from human fetal tissue cell lines and have nothing like that in them. Those with a history of severe allergies, however, like to nuts, like peanuts, who are allergic to some types of lipids, you can get allergic reaction to these vaccines because they do contain some kind of lipids that people are allergic to, like what's called polyethylene glycol. And if you have a history of allergy, you should probably still get the vaccine, but let your doctor know and be closely observed for about an hour afterward. So here's the vaccine in a lipid droplet. It's got the RNA in there surrounded by these little fat droplets, and that's how it gets delivered inside your cell. So vaccines are dangerous. They're experimental and untested, and they're not FDA approved. However, they aren't FDA approved because of a technicality that the FDA requires 6 months after the initial trial period in order to observe the population of the trial population before you can get FDA approval, and that just happened this month in April. At this point in time, Pfizer in particular is open for FDA approval, full FDA approval. Right now it's been given emergency use authorization, and that authorization is based on extensive studies, 70,000 humans in the initial trials, as well as animal studies, double-blinded placebo-controlled trials, and they were extremely successful. Also, these vaccines, mRNA technology, has been studied more than 30 years. Scientists know very well how it works, the risks, the benefits, and there are risks, but they're known and they've been modified in order to adjust for those risks and make them less risky. As far as the benefits are concerned, the efficacy, this is amazing. Israel is leading the world in vaccines. They've given 5 million, which is more than 60% of their population, getting close to herd immunity. The U.S. has given 80 million fully vaccinated people now. And so what does this mean as far as efficacy is concerned? You hear a bunch of numbers, but what does it really mean? You have a 1 in 1,000 chance of contracting the disease after your second dose 2 weeks after. That's a 0.1% chance. Of those who do get sick, that 1 in 1,000, of those 1 in 1,000 people who do get sick, 1% get hospitalized, 0.001% total. Of those hospitalized, 10% will die, 0.0001%. And so the death rate, 0.0001% death rate, that's a death rate of 1 in a million people who've been vaccinated. You're highly protected after your second dose as far as death is concerned. Okay? That's amazing. That's way, way better than expected initially when these first trials went into production. So there's 1.7 in 1,000 Americans have died of COVID-19 so far in the U.S. alone. Way higher death rate if you get infected with the virus than if you get the vaccine, 1 in a million. Pfizer, Moderna, they are the mRNA vaccines. Autoimmune disorders, it's possible but very rare. ITP, for example, where you attack your own platelets, 1 in a million chance as far as death is concerned. The risk of ITP for COVID-19, 40 to 50 times higher. So you can't escape risk. Which risk are you going to choose? DNA vaccines, Johnson & Johnson, AstraZeneca, show rare increase in blood clots. Again, 1 in a million, 1 death out of 6 cases of cerebrovascular sinus thrombosis, all women, all young women. So this is a real risk. And if you have an option, if you had no option, I would probably take the DNA vaccine. But since we have an option, why take the increased risk? Just take the mRNA vaccine. Why are these blood clots happening in these young women? Well, it's a mode of transmission, I think, and there's some evidence along these lines. It's not conclusive, but there's some suggestion that it's the viral vector. They take an adenovirus shell, empty it out, and put the vaccine DNA into it, and then inject that into you. 50 million copies of this into your arm, and then that gets inside of your cell, into the nucleus, and then makes the mRNA and then makes the protein. That's how it works. And so you can develop an immune response to the shell, to the viral shell, and that increases your odds of other problems. But with the mRNA vaccines, there is no viral shell. There is no other protein besides the small spike protein that's produced by the mRNA. And so there's not much less risk. There is less risk for the mRNA vaccines. So again, let's talk about odds. 1 in a million, what does that compare with? 1 in 2,000 women who take oral contraceptives get blood clots. 1 in 1,000 people who fly on airplanes get blood clots. 1 in 10 people with COVID-19 have blood clots, DVTs, PEs, etc. 1 in 3 people with COVID-19 will get immune thrombocytopenia, where you attack your own platelets and your platelets drop. You might not die, but your platelets go down. In comparison, 1 in 700,000 people get struck by lightning per year, right? So just to put things in perspective. So the antibody-dependent enhancement, this is a risk you'll see all the time proposed by doctors on the internet who are anti-vaccine. It's where if you get the vaccine, it makes the disease worse when you get it later. This is a well-known problem, and they know how to solve this problem for these particular vaccines. It took several years to solve this problem, and it was kind of a happy accident. What happened is they figured out that these proteins, the spike protein, can morph into different shapes. If you stop it from morphing in one particular type of shape, you will not develop ADE, or your risk will be minimal for that. And so that's what they did. They stopped it in the clumpy shape right there. And because of that, your risk for ADE, or antigen-dependent enhancement, pretty much goes away. So that's really not a valid risk. So the vaccines are unnatural opposed to the Adventist health message. Let me ask, what's more unnatural? Getting infected by a foreign invader, like a spacecraft, basically, that's designed by the devil himself, that causes severe illness and disease and long-term problems, or getting a vaccine? You know, either way, you're being attacked by something designed by somebody, well, I think one way, certainly by somebody evil, the other way, by somebody who's trying to stop something evil. Ellen White's son, William White, was vaccinated for smallpox with his mother's knowledge and approval, and despite having a bad childhood experience with vaccines. So in other words, Ellen White, who had the health message, gave her children vaccines. And then later, he had a bad outcome when he was a child, because back then they were grown on cultures that had infections in them, bacteria and stuff. So he got a secondary infection, which was common back then. And still, when he became an adult, after sitting down with the doctor for a while, she approved him getting a vaccine for smallpox, because the risk was higher, much higher for the smallpox, even with the health message. The health message reduced the death rate for smallpox from 30% in children to about a little less than 10%. Still not great, but better than nothing. The vaccine reduced it way farther than that. That's why she approved it. And then here's the letter from William White. If you want to read it later, I have it. And then her own secretary, Robinson, who was her secretary for 13 years and married her granddaughter, he said that she actually got the vaccine herself and recommended to her staff. And it's kind of believable to me, especially given what William White said, that she also got it herself, because she also recommended drugs like quinine to fight malaria, anesthesia for surgery, blood transfusions for people who were dying from bleeding out, pain relievers for intense pain, and she had radiation therapy for a skin lesion on her face herself. So she was perfectly in line with what seemed reasonable to her for modern therapies of her day. And this is a sad story. She told people not to use quinine like in tonics to make yourself feel better, just for general purposes. She said it's a poison, you shouldn't use it. So this man who was in the mission field as a missionary, his boy got sick with malaria, and he did not give the boy quinine because he was reading the health message from Ellen White, and that's what he interpreted, and the boy died. So he came to her later at a meeting when he met up with her, and he asked her this question. He said, "Would I have sinned to give the boy quinine when I knew of no other way to check malaria, when the prospect was that he would die without it?" And she said, "No, we are expected to do the best that we can." And then she wrote elsewhere, "If quinine will save a life, use quinine. Just don't be stupid about it," right? Natural remedies are enough. I'm a big fan of all of these things. Vitamin D, again, it could reduce death rates by COVID-19 by 80%, I believe. Sleep, get your 8 hours of sleep, hot cold therapy, quercetin, zinc, magnesium, N-acetylcholine, vitamin C, forced bathing, exercise, physical fitness, etc., all great. They help the innate immune system. The problem is they don't help the adaptive immune system learn what to attack better in the future. The mRNA vaccines, they're still very helpful for educating the adaptive immune system. for the best overall chance at fighting COVID-19 without a significant damage to the body. From my perspective, do it all. Be healthy, do all these things, and take the vaccine. What about the argument that God will save me, so I have no fear, I don't have to do all these things? I don't have to do anything, God will save me. It's like the guy who was sitting on the roof of his house during a flood, and 2 boats came by and a helicopter to save him. He's like, nope, God will save me. So then he drowns, he gets all upset, goes to heaven, hey God, why didn't you save me? God says, well, my son, I sent you 2 boats and a helicopter. Right? You got to accept the gifts that God gives you. And just to show you, there are 2 different immune systems in the body. One works best if you have good health. The other, and it degrades over time. As you get older, it doesn't work so well. The other works best if you educate the immune system by exposing yourself to antigens. And one way to do that without getting sick is with a vaccine. So again, recommendations, do it all. And here's a list of dosages if you want to go back and refer to this slide. How much should you take? And I would be remiss if I didn't mention my brother-in-law. He pretty much gave me everything except for the vitamin D ideas. I gave him that particular one. And he's a pulmonologist in Southern California. He runs an excellent website, medcram.com. He has a bunch of YouTube videos that get millions of hits. He's well known. He's the one who was referred to when the doctors were on the cruise ships and nobody could help. They asked Roger what to do. Anyway, if you have any questions about the details, medcram.com or look up Roger Schwelt on YouTube. Thanks, guys.